problem. The FDA was very worried about powered needles going into people's bones with paramedics, so we had to get manufacturing. So I found my old friend Bob Tickelmeyer. Bob, could you stand up? Very fortuitous. Bob called me. He was in North Carolina or someplace like that. He said, I saw something in the paper about you. Is this the same Larry Miller? I said, yes. He said, do you need anybody to help you with manufacturing, engineering, and regulatory? I said, boy, do I ever. How soon can you get here, Bob? And he had worked for me 20 years before. So there's a rainbow over Bob's head, and he really helped us get going with our engineering, our testing, our FDA approval. And we've had 3 inspections now of the FDA, and not a single demerit. So after Flynn got our manufacturing in Santo Domingo, and then we had the task of how are we going to sell this thing? We can't afford to hire any salespeople. So that's when I met this gentleman, Jim. Jim came to work for us, and Jim put together an awesome network of specialty dealers that he was good with. He'd been with U.S. Surgical and other companies. And so we hit the ground running with about 60 salesmen we didn't have to pay for. It was kind of neat. And since then we've gone to direct sales, but that's the way we started. And it was pretty amazing. So with the 4 of us, we started this company. And the biggest challenge we had, honestly, at that point was how do you get paramedics to use this? I know a number. How many of you are paramedics in this group right now? Right? See quite a few. And nurses? Thank you very much. Paramedics are my heroes, they really are, because what they do out in the field is just phenomenal. But anyway, how do you get a paramedic to drill somebody's bone? They say that's only something that an orthopedic surgeon can do. So, Jim and I and others, we decided what we'd do is invite the medical directors for the 25 largest cities in the United States to San Antonio for a conference. We invited them, 18 of them came from big cities like Miami, Chicago, New York, Los Angeles, San Francisco, all the big cities. And we put on a seminar, not to sell the ECIO, but to tell them about intraosseous. That means inside the bone. How does it work? We let them try it out on cadavers and animals, and they tried it out once themselves, and they all sold themselves. They left here enthusiastic about intraosseous. That way we hit the top tier of people and opinion leaders all across the country in one fell swoop. That's what wants to come to. So anyway, how does it work? Just for those of you who do not know intraosseous, here's a little picture. We can use several bones. This is a bone just below the kneecap, the tibia. We picked that bone because it's devoid of any dangerous things. You don't want paramedics hitting an artery or something. So you clean it up with alcohol or chlorhexidine. And then you take the driver, take the cap off the needle, and it literally takes less than 5 seconds to drill the needle into the bone. Now, it looks like it'll hurt. We'll show you that in a minute. But once the needle's in the bone, as we mentioned, we take out the spinelette. At this point, it's ready to hook up your IV or your medication. So here we're hooking up an IV. And you can see as the medication comes into the bone, I'm going to show you what that big vein looks like. How you've seen this in your space sometime. The medicine goes into the interosseous space and immediately it's taken up with the large veins. Now you say this is an animation that it's not really true. Well, to show you it's really true, here's an actual live person. This person happens to be a goat. I do have pictures of it. But the point is, you can see how fast the medication gets from the shoulder to the heart. It takes less than a second. This amazes doctors. It amazed me. And this shows you that it's really connected. It's just like putting a central line into the BMK, but it just dumps right into the heart immediately. So how does it go into a human? Well, it goes into a human pretty fast. This was the second human to ever get it. I was the first one. And I'll just show you how quickly it goes in and how it...
I was sweating. I weight that in 2.
What?
Yeah, that's definitely 2.
All right, now we're going to aspirate.
I can't really you're aspirating.
Isn't that beautiful? Oh, it's coming out so easy.
Yeah, I can tell you that the insertion was like next time, nothing.
Really?
Absolutely next to nothing.
Wow. It was fast. It went
It was really fast.
It was
Shocking
shocking.
that I've had IDs that are worse.
Okay, we're going to use the
So
technique.
he had IVs that are worse. So that's typically what they do. So the history of the EasyIO since we introduced it in 2005 is that we sold over 2 million of these to date. We're using over 40,000 a month now around the world. We're in 70% of emergency rooms, 90% of EMS services, about 60 countries. It's become the standard of care, as Davis mentioned, in so many organizations. But for us, the American College of Emergency Physicians and the American Heart Association have endorsed it as a route of choice in cardiac arrest and whenever difficult IVs are encountered. We've also been surprised, and I was amazed. When we first started this, I laid awake at night worrying about infections. I said, we're going to get 2 or 3 infections in the first 100, and the company will be all over. And I kept worrying after we had 100, 200, 300 no infections. We've had 1 infection reported out of selling 2 million, so it's been extremely safe. It's been way safer than IV. EasyIO has received some awards and some rewards. Is already done. Davis mentioned the Wall Street Journal Award. I was shocked because there were 700 companies there, including Apple with the iPhone and Honda and Facebook and all these people. And I didn't even know why we were applying for it. It didn't make any sense. And we got the gold award. I was totally shocked. And it tells me something about Wall Street, that they were more interested in saving human lives and neat technology, just for the sake of technology. So I'm going to take that picture off so you won't get grossed off. So by all indications, when you look at the company, the way it's growing, the sales, the profitability, the way it's been accepted, you'd have to say it's a very successful company. But I don't measure success that way at all. Personally, I measure success by this. This is the 86 Cash, the combat surgical hospital in Baghdad. When we first started sending the EasyIO over there, I was talking to some of the military people earlier, we didn't know how to sell to the military, and they didn't know how to buy it from us. And so they just sent us an email, we need some more EasyIOs, and we'd ship it over by FedEx, so you get it the next day, or the day after. And for 2 years, we supplied the military with over 3,000 EasyIOs just by that method. We finally figured out how to sell it to the Army. It took a while. But this letter, what my real reward is from the hundreds of doctors, nurses, and paramedics, actually thousands, that have told me that it's changed their way they practice medicine. It's taken away the fear of starting IV. It's allowed them to practice to the best of their ability and never have to worry about a difficult IV again. And this is one letter I have in my office that's very dear to me from Colonel Swift, and it states, this device truly saved the life of a combat wounded U.S. soldier. So that's what it's all about for me. Thanks again for all your hard work and research. This product is truly making a difference in our soldiers' way. How do you make your dreams come true? Well, for me, it was easy. People have asked me, how did you become successful? I'm not a hero. I'm not nobody special. What I am special about, I surrounded myself with people that are smarter than I am. That was easy for me to do. And I surrounded myself with great investors that believed in me, with opinion leaders that supported me, and put together a staff of just really dynamite people that are passionate about what we're doing. They love to come to work because they know we're saving lives. So that's what I did. And so I say the same thing to you. My secret is to do the same. Surround yourself with people that are smarter than yourself. Find the best in the field. Be their cheerleader. Be kind. Be generous. And you have to be very persistent. You really do. It's never as easy as you think it will be. You think it may take a year, it may take 3 or 4 years, and you just can't give up. And for me, one of the most important things is this: do everything for the right reason. So if there's a question comes up, should we do this or that, ask yourself this one question: what is in the best interest of the patient? If you do what's in the best interest of the patient, you will do what's in the best interest of your company. It will come back to reward you over and over again. So always think of what is in the best interest of your patient. I just want to say gracias to a few people. First of all, my family, with my Miller family, stand up, please. They supported me through good times and bad times. I mean, I spent my retirement on this company, and so it was economic hard times. I remember when we started out, our office was Starbucks, and our laboratory was my garage. So Eric and I were out trying out needles and drivers on bones. We went to the butcher shop and got the bones. And after we were done with them, I threw them out in the back. We lived out in the country. I thought the animals could benefit from it. But some dogs came by and took the bones to the neighbors, and they called the police and thought there was some kind of I also want to thank our VitaCare staff. And I have my VitaCare staff stand up, please. We absolutely have the most awesome group, and Mark Millen, our CEO, is an awesome guy, and so proud to work for him. So we thank them. I also want to thank Dr. Julio Palmaz, because he's inspired us, right? And more than that, his most famous recipient was Mother Teresa. I'm also one of the recipients, and probably standing here because of him. Thank you very much. Lastly, I'd like to thank the Biomed San Antonio. This is exactly what we need for supporting innovation. This is extremely important for the future of San Antonio. I just wish he had been there when we started. It would have saved us 2 years, at least, in development, if you'd been here then. So you're doing the right thing. I'm so proud of what you're doing, and I totally support you as being so critical to bring the critical mass together to make bioscience a real hot center in San Antonio. We want to compete with San Diego, right? Take over from San Diego.